Hello and welcome to ASA Live. We are back again this week and we are excited because you are watching this right now as we are preparing to leave and head to New Orleans. Your ASA staff starts leaving this afternoon. In fact, I get on the airplane this afternoon. And then we will be flowing into New Orleans over the next couple of days until we greet all of you on Sunday and Monday as you arrive. So this is pretty exciting for us because we are coming back live and in person. And this has been a long time coming for all of us. So we can't wait to see you there. In fact, the person I'm talking to today will be there. And we were, right before we started this, we were just sitting here talking about how exciting that is. So let me introduce you to Kim. If you haven't seen her on an ASA Live before, I don't know where you've been, but Kim Callinan is the president and CEO of Compassionate Choices. During her tenure there, Kim has played a leadership role in authorizing and implementing medical aid in dying into 6 new jurisdictions. Those are California, Colorado, Washington, D.C., Hawaii, New Jersey, and New Mexico, as well as launching their Finish Strong initiative, which includes a book and a suite of new tools designed to empower patients to take charge of the final chapters of their lives. And that, of course, provides focused efforts on helping people plan for a possible dementia diagnosis and closing the disparities in end-of-life care and planning that exist for communities of color. Kim, welcome back.
Thanks. Thanks so much for having me. And I'm really looking forward to being in New Orleans with you all as well. So it should be a really great event.
Well, thank you. And what we're talking about today is particularly interesting because so often when we talk about choosing end-of-life plans and making those plans, so many things that we think about, our cognitive facilities would still be there. With dementia, you don't necessarily have that. And so the planning that takes place is a whole different concept, I'm assuming.
Yes.
So let's first of all talk about it as a whole in our country. We're talking about mental health differently. We are certainly talking about dementia differently. There is an open dialogue about this, really for the first time in many cases. And so how do you think that dementia has affected our society at this point?
So dementia is one of those diseases that is just impacting us and affecting so many people. By the time you're 65, 1 in 3 people has dementia, and that number increases as people age. So the vast majority of people know somebody who has dementia, a friend, a loved one, or they themselves have dementia. And so it's one of those diseases that is just touching more and more people. And I think it raises a lot of fear. It's not uncommon for me to talk to somebody and the very first thing they say to me is, the very last thing that I want to do is live in a state of advanced dementia. Like, how do I avoid that? There's real fear around dementia. So one thing that I do want to say to people that I think is important is that at the onset of a dementia diagnosis, people can still have many, many years left where they have good quality of life and where they get meaning out of their life. So I do think it's important for anyone who's facing a dementia diagnosis that you realize that, you know, there's a lot of years, could potentially be a lot of years before you hit what you think of as the worst part of dementia. So that's important, but it's also important that people recognize that they do have some options available to them to avoid the final stages of dementia, if that's something that they desire to do.
Absolutely. And it's, I think it is interesting to note, as you're saying, this isn't something that necessarily goes very quickly. And so that means that there probably is some time to make the plans that you want to have. So one of your strategic objectives has been to transform how people die with dementia. Talk to us about this initiative and why this has become so central to your work.
Sure. So as I mentioned, dementia is just a disease that touches everyone, and it's growing. It's actually a problem that man created through progress, which so often happens when you think about just about any invention. Along with that comes some new challenge. And we got really, really good at curing diseases. So decades ago, people died of heart attacks, diabetes, pneumonia, and now we have treatments for all of them. And we can keep people alive for a really, really long period of time. And in our healthcare system, the goal of care continues to be the extension of life, no matter what. So when I get a dementia diagnosis, I will continue to be treated as if the goal of my care is the extension of life. And so I could be 80 years old in a state of advanced dementia, have no awareness of the recognition around me. But my pneumonia will still be treated, my diabetes will still be treated, my heart disease will still be treated. And in many instances, I could get rushed to the emergency room, and I could end up with an IV inserted, CPR given with my ribs broken, and other very invasive treatments, which are actually just awful for someone with dementia to go through because of the disorientation. And for some small percentage of the population, that is what they would want. We know from survey data that about 10% of people still would want all of those invasive treatments, even if they had advanced dementia. However, the vast majority of people do not want to live in a state of advanced dementia. But the general feeling right now is I don't have any other options, that there's no legal option, and it's just not true. Everybody has a legal right to pre-claim their voice and to forego treatments. And so you can cut years off the length of time that somebody lives with dementia if they document their wishes, if they have a very strong healthcare advocate that's by their side advocating for them, and if they pre-plan. And so our dementia program is really about empowering individuals to recognize the options that they do have and take the necessary steps so that they can plan. And it's also to transform the medical community so that they are embracing patients and helping to support patients through these options, rather than assuming the goal of care is the extension of life. And of course, we make no judgments. Like if somebody wants all available treatment options, that's totally fine. We make no judgments, but we know that it's not what the vast majority of people want, and that many, many people feel helpless right now as if they don't have an out.
Absolutely. And I'm, these toolkits that you have created, that you have available online, get right to this, right? They really dig into how to support somebody who has been diagnosed with dementia, and supporting the caregivers, right? Because I assume, right, I've made the decision that I don't want to live with this disease in the long run. But my caregivers oftentimes are people who love me very much. And so there's a lot to digest in there. What are you doing with these toolkits, and how do those tools work?
Sure. So we have two tools that are available to people. The first is the Dementia Values and Priorities tool. And this one is my favorite. It creates a customized advanced directive that looks at the common symptoms that people get throughout a dementia diagnosis. Because one of the things that's really, really hard for a caregiver is people will say things like, I don't want to live that way. But what way don't you want to live? Is it that the moment that you no longer recognize me, that's the moment you don't want to live? Or you don't want to live when you're bedridden and you can't get out of bed or dress yourself or feed yourself? Like, what is that moment for you? And how long do you have to have that moment? What if you're going in and out of different phases? So we kind of go through some the common progression of dementia, and it's different for every person, but that's okay. We have about 15 different symptoms, and a person also has the option to put their own in. And it's simple things like, I can no longer recognize my loved ones. I'm violent and angry. I can no longer I no longer get pleasure out of life anymore. So there's a whole host of different criteria measures, and you sort of choose the ones you want. And it's really interesting to go through and do it with someone. I did it with my mom and my dad. They are on entirely different spectrums. You know, my dad would be someone very early stages, losing his mind. That's his kind of line in the sand. And my mom is much farther down. And then you can decide the level of care that you want. And it's everything from, I want to continue to get everything and get all life-saving treatments, to, okay, I don't want life-saving treatments that are aggressive and prolonging my life, but I still want to get my other diseases treated, like my diabetes or my kidney disease, to, do you know what? Let's start looking for ways that I can forego treatments that would allow a natural death. And so you choose the options that you want based on where you are in the disease. And it puts together a customized plan. It does it all through the computer. And then you can change it and modify it. It allows you to save it because people change their mind as they go along. So you could, your ideas now of what you want might be different in 10 years. It lets you save it and you can go back in. You select a healthcare proxy. You can also select people that you don't want to be able to speak on your behalf. And this is really important if you have a family where there is not agreement. So it's a super powerful tool. We call it the dementia values and priorities tool, but the reality is it's helpful really anytime you can't speak for yourself, because it really helps people to understand, what does quality of life mean to you, and what is your kind of line in the sand. So I would encourage everybody to do that. You do it when you're healthy. It's there for you. You make sure your healthcare proxy has it. You make sure your doctor has it. That's really important. The other tool that we have is the Dementia Decoder, and it produces a list of questions that a person who's in early stages of dementia could ask, or their healthcare proxy could ask on their behalf, to help navigate the kind of care options that they want. And it's like your coach that's like sitting over your shoulder, your little coach saying, make sure you ask them about this and don't forget about that. And, it lets you, it gives you a little bit of confidence in knowing that you've got these questions that have been vetted by other physicians that will help to guide your care.
Those are incredible. And it's interesting as you were talking this through, because it gives so much power to the individual in a time in which they have feeling that they are losing their power. And I can feel the importance of that. As a caregiver, I can feel the importance of that. So we as caregivers and we as the individuals have a certain level of responsibility in all of this. But there is a role for the medical and healthcare community in all of this as well. And so what is their role as it relates to the dementia diagnosis and treatment and making plans?
That is a great question. And you're right. Doctors and nurses and social workers, they are partners with the patient in helping them to get the care they want. And all too often, what we see now, unfortunately, is that partnership isn't really working. And the goal of care within medicine right now does continue to be the extension of life no matter what. And it is not uncommon for a patient who has done all of this work and documented their preferences to reach out to their healthcare provider and receive resistance. And it's understandable. Healthcare providers go to medical school in order to cure. And so this idea that, okay, I'm not going to cure, I'm going to, help you realize a natural death, it's a hard one. It's a hard pill to swallow for some people. But I would encourage the medical community to really embrace the idea of patient-directed care, to really listen to the values and priorities of your patients. Palliative care doctors are excellent at this. So there's, they are trained, they are excellent, they are models of kind of how this work can be done. And others are starting to really understand the importance of it. And to construct policies that are going to respect the patient's values, that are going to honor their wishes to forego treatments, and really support them if that's what they seek. And hopefully we'll be able to create a cultural shift. In an ideal world, the doctor's bringing forward the idea of the tool. They're sharing the tool with the patient and saying, I understand this is hard. You just recently got diagnosed. This may be something that you want to consider for yourself and work with your healthcare proxy, because helping to put the decisions back in the patient's hand while they still have the ability to make decisions will make it so much easier later for both the healthcare team and also for those caregivers.
You know, you're talking about that ideal world, right? Like if we get to this ideal place, the healthcare community will support this by providing these resources to their patients. Let's talk about that ideal world. Let's say that we actually get to this place in which we have transformed how people die with dementia, and they can own that process themselves. What does success really look like for compassion and choices?
Yeah. So the success isn't really for us. The success is really for the world. But it's a world where patients feel empowered at the onset of a dementia diagnosis. They recognize and appreciate that they do have options. Obviously, they want treatment, and we can't get them that. And there are lots of other organizations that focus on that. But once they sort of acknowledge the fact that there is not a cure right now, and they're ready to start thinking about their end, they're no longer worried about, I'm going to have to, go on for years living in a state of advanced dementia. They feel supported by their family. The idea that they may want to choose to forego a treatment for their diabetes and so that they can have a natural death is embraced by their family and understood and respected if that's the decision they want. And it's embraced by the healthcare community. And the healthcare community is proactively discussing it with their patients. And if we had a world that looked like that, it would result in far more people being able to have a much better quality of life through the end. So if people weren't spending those early years of a dementia diagnosis when they still do have a meaningful ability to have conversations, or they might be singing or dancing or other ways that they're able to engage with society and with themselves, if that wasn't taken away from them because it was full of fear, and instead they felt empowered that when I hit that point, that moment that is beyond the point that I find life meaningful, I will have an out. I think it will open up the world. It will create far better relationships and connections at life's end.
Absolutely. And it's, as all the time, every time I talk to you, I come away thinking about things a little bit differently. I come away thinking about my own personal world and what does this bring to that space. I always say that ASA is good for your professional career. It's also good for your personal life. So I really appreciate these conversations. You are going to be On Aging, and you're presenting a couple of times.
I am.
You want to give everybody a quick, the 1 minute preview of what you're going to be presenting on, and pitch your sessions quickly?
Yeah, I have 2 sessions, 2 workshops, and 1 poster session. I'm doing and I'm presenting with a couple of other colleagues who are really, really powerful. So I'm doing 1 short workshop around medical aid and dying. I'm doing 1 workshop around inequities in end-of-life care, and I am doing a poster session on voluntarily stopping eating and drinking. And voluntarily stopping eating and drinking is an option for somebody who is in the early stages of a dementia diagnosis and wants to exit. And it's one of the few ways that somebody can do that early on. So the workshop should be fun. My co-presenters are fabulous. So I hope people will choose to join us.
Wonderful. Well, I cannot wait to see you in person. I have, this week I've been able to talk to different groups about On Aging. And the thing I just keep saying, because I cannot be more clear, is I would like some hugs. I am a hugger. But that being said, I know there's a pandemic that's still raging. And so we are working to keep this very safe and a very healthy experience. Masks are going to be required. We are requiring you to be vaccinated. And if you are eligible, you need to have your booster. And we are also implementing a social distancing plan so that people can really voice for themselves about what they are comfortable with. so you'll see information about that social distancing plan when you check in to get your name tag. Note that I will, as I said, my social distancing plan is a hug. So not necessarily the smartest move, but I need some good ones. So I thank you for doing this with me today. For everybody who is joining us in 2 weeks, it's not even 2 weeks at this point, in a matter of like 4 days. If you are meeting with us in 4 days in New Orleans, we can't wait. If you are not joining us in New Orleans and you are electing to kind of get the recorded content, if you're still attending some of our pre-conference events on the forum that we've created for this event, I'm sorry that you're doing this all virtually because the beignets are delicious in New Orleans, but we understand, and we will see you in Atlanta next year. So, you know what? And there's really good food in Atlanta. Thank you all, and we can't wait to see you. Kim, thank you for doing this with us. And I will see you just in a few days.
Thanks so much, Cindy. Appreciate it. Bye-bye.
Bye-bye.